Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Long-term oxygen therapy for 24 or 15 hours per day in severe hypoxemia. Background. Long-term oxygen supplementation for at least 15 hours per day prolongs survival among patients with severe hypoxemia. On the basis of a non-randomized comparison, long-term oxygen therapy has been recommended to be used for 24 hours per day, a more burdensome regimen. Results. Between May 18, 2018, and April 4, 2022, a total of 241 patients were randomly assigned to receive long-term oxygen therapy for 24 hours per day, 117 patients, or 15 hours per day, 124 patients. No patient was lost to follow-up. At 12 months, the median patient-reported daily duration of oxygen therapy was 24.0 hours, interquartile range 21.0 to 24.0. In the 24-hour group and 15.0 hours, interquartile range 15.0 to 16.0, in the 15-hour group. The risk of hospitalization or death within 1 year in the 24-hour group was not lower than that in the 15-hour group. Mean rate 124.7 and 124.5 events per 100 person-years, respectively. Hazard ratio 0.99. 95% confidence interval, CI 0.72 to 1.36. 90% CI 0.76 to 1.29. P equals 0.007 for non-superiority. The groups did not differ substantially in the incidence of hospitalization for any cause, death from any cause, or adverse events. Conclusions. Among patients with severe hypoxemia, long-term oxygen therapy used for 24 hours per day did not result in a lower risk of hospitalization or death within 1 year than therapy for 15 hours per day. Community-based cluster-randomized trial to reduce opioid overdose deaths. Background. Evidence-based practices for reducing opioid-related overdose deaths include overdose education and naloxone distribution, the use of medications for the treatment of opioid use disorder, and prescription opioid safety. Data are needed on the effectiveness of a community-engaged intervention to reduce opioid-related overdose deaths through enhanced uptake of these practices. Results. During the comparison period from July 2021 through June 2022, the population averaged rates of opioid-related overdose deaths were similar in the intervention group and the control group, 47.2 deaths per 100,000 population versus 51.7 per 100,000 population, for an adjusted rate ratio of 0.91, 95% confidence interval, 0.76 to 1.09, P equals 0.30. The effect of the intervention on the rate of opioid-related overdose deaths did not differ appreciably according to state, urban, or rural category, age, sex, or race, or ethnic group. Intervention communities implemented 615 evidence-based practice strategies from the 806 strategies selected by communities. 254 involving overdose education and naloxone distribution, 256 involving the use of medications for opioid use disorder, and 105 involving prescription opioid safety. Of these evidence-based practice strategies, only 235, 38%, had been initiated by the start of the comparison year. Conclusions. In this 12-month multimodal intervention trial involving community coalitions in the deployment of evidence-based practices to reduce opioid overdose deaths, death rates were similar in the intervention group and the control group in the context of the COVID-19 pandemic and the fentanyl-related overdose epidemic. Axatilimab in recurrent or refractory chronic graft-versus-host disease. Background. Colony stimulating factor 1 receptor, CSF1R, dependent monocytes and macrophages, are key mediators of chronic graft-versus-host disease, GVHD, a major long-term complication of allogeneic hematopoietic stem cell transplantation. The CSF1R blocking antibody Axatilimab has shown promising clinical activity in chronic GVHD. Results. A total of 241 patients were enrolled, 80 patients in the 0.3 mg dose group, 81 in the 1 mg dose group, and 80 in the 3 mg dose group. The primary endpoint was met in all the groups. An overall response was observed in 74%, 95% confidence interval, CI, 63 to 83, of the patients in the 0.3 mg dose group, 67%, 95% CI, 55 to 77, of the patients in the 1 mg dose group, and 50%, 95% CI, 39 to 61, of the patients in the 3 mg dose group. A reduction of more than 5 points on the modified Lee symptom scale was reported in 60%, 69%, and 41% of the patients in the 3 dose groups, respectively. The most common adverse events were dose-dependent transient laboratory abnormalities related to CSF1R blockade. Adverse events leading to discontinuation of Axatilimab occurred in 6% of the patients in the 0.3 mg dose group, 22% in the 1 mg dose group, and 18% in the 3 mg dose group. Conclusions. Targeting CSF1R-dependent monocytes and macrophages with Axatilimab resulted in a high incidence of response among patients with recurrent or refractory chronic GVHD. Pomalidomide for Epistaxis in hereditary hemorrhagic telangiectasia. Background. Hereditary hemorrhagic telangiectasia, HHT, is characterized by extensive telangiectasias and arteriovenous malformations. The primary clinical manifestation is epistaxis that results in iron deficiency anemia and reduced health-related quality of life. Results. The trial was closed to enrollment in June 2023 after a planned interim analysis met a pre-specified threshold for efficacy. A total of 144 patients underwent randomization. 95 patients were assigned to receive pomalidomide, and 49 to receive placebo. The baseline mean, plus or minus, epistaxis severity score, was 5.0, plus or minus 1.5, a finding consistent with moderate to severe epistaxis. At 24 weeks, the mean difference between the pomalidomide group and the placebo group in the change from baseline in the epistaxis severity score was minus 0.94 points. 95% confidence interval, CI, minus 1.57 to minus 0.31, p equals 0.004. The mean difference in the changes in the HHT specific quality of life score between the groups was minus 1.4 points. 95% CI, minus 2.6 to minus 0.3. Adverse events that were more common in the pomalidomide group than in the placebo group included neutropenia, constipation, and rash. Conclusions. Among patients with HHT, pomalidomide treatment resulted in a significant, clinically relevant reduction in epistaxis severity. No unexpected safety signals were identified. Next, we will be discussing articles from Journal of American Medical Association. Risk stratification in nonischemic dilated cardiomyopathy using CMR imaging. A systematic review and meta-analysis. Question: are cardiac magnetic resonance imaging derived measurements associated with adverse outcomes in nonischemic dilated cardiomyopathy, NIDGM? Findings. In this meta-analysis of 103 studies, comprising 29,687 patients with NIDGM, late gadolinium enhancement, LGE, presence and extent, were consistently associated with arrhythmic, non-arrhythmic, and mortality endpoints, whereas left ventricular ejection fraction, LVEF, was not significantly associated with mortality and arrhythmia. Higher native T1 relaxation times were associated with arrhythmic endpoints, and major adverse cardiac events. Due to insufficient data, a pooled analysis could not be conducted for the measurements of native T1 relaxation times, extracellular volume fraction, and global longitudinal strain concerning mortality endpoints, meaning the presence and extent of LGE were associated with adverse clinical outcomes, whereas LEF was not associated with mortality and arrhythmic endpoints in NIDGM. Malaria rapid tests, febrile illness management, and child mortality across sub-Saharan African countries. Question: how has the wide-scale distribution of rapid diagnostic tests for malaria across sub-Saharan African countries affected febrile illness management and mortality for children younger than 5 years of age? Findings: increasing distribution of rapid diagnostic tests for malaria was associated with increased blood testing, use of antimalarial drugs, and antibiotic use and modestly improved child survival. The greatest benefits occurred in areas with a high prevalence of malaria, meaning the distribution of rapid diagnostic tests for malaria was associated with changes in pediatric febrile illness management and improved survival. Next, we will be discussing articles from Annals of Internal Medicine. Factors associated with recurrent pediatric firearm injury, a 10-year retrospective cohort analysis. Background: firearm injuries are the leading cause of death among children aged 0 to 17 years in the United States. Results: during the 10-year study period, 1,340 children presented with an index firearm injury. Most patients were Black, 87%, non-Hispanic, 99%, male, 84%, and between the ages of 15 and 17 years, 67%. The estimated risk for firearm re-injury was 6% at 1 year and 14% at 5 years after initial injury. Male children and those seen at an adult hospital were at increased risk for re-injury. Conclusion: children who experience an initial firearm injury are at high risk for experiencing a recurrent firearm injury. Interventions are needed to reduce re-injury and address inequities in the demographic and clinical profiles within this cohort of children. Class I recalls of cardiovascular devices between 2013 and 2022, a cross-sectional analysis. Background: cardiovascular devices account for 1/3 of all Class I recalls. The U.S. Food and Drug Administration's, FDA, most severe designation, indicating a reasonable probability of serious adverse health consequences or death. Understanding recalls and their causes is important for patient safety. Results: from 2013 to 2022, there were 137 Class I recall events affecting 157 unique cardiovascular devices, of which 112, 71.3%, were moderate risk 510K devices and 45, 28.7%, were high-risk pre-market approval, PMA, devices. Recalls affected a median of 7,649 units. IQR, 953 to 28,446, and were most commonly attributed to device design, 43, 31.4%, 42, 26.8%, devices had multiple Class I recalls, 30, 19.1%, devices underwent pre-market clinical testing, 7, 6.2%, 510K devices, 17, 85.0%, PMA devices, and 6, 24.0%, PMA supplement devices. Most studies used surrogate, 27, 79.4%, and composite, 24, 70.6%, measures as primary endpoints. 22, 48.9%, PMA devices had required post-approval studies, with 14 reporting delays. Number 510K devices were subject to post-market surveillance. Conclusion: cardiovascular devices with Class I recalls were infrequently subjected to pre-market or post-market testing, with recalls affecting thousands of patients annually. Next, we will be discussing articles from British Medical Journal. Cumulative live birth rate of a blastocyst versus cleavage stage embryo transfer policy during in vitro fertilization in women with a good prognosis. Objectives: to evaluate whether embryo transfers at blastocyst stage improve the cumulative live birth rate after oocyte retrieval, including both fresh and frozen thawed transfers, and whether the risk of obstetric and perinatal complications is increased compared with cleavage stage embryo transfers during in vitro fertilization. IVF treatment. Results: the cumulative live birth rate did not differ between the blastocyst group and cleavage group. 58.9%, 355 of 603, v 58.4%, 350 of 599. Risk ratio 1.01, 95% confidence interval, CI, 0.84 to 1.22. The blastocyst group showed a higher live birth rate after fresh embryo transfer, 1.26, 1.00 to 1.58, lower cumulative pregnancy loss rate, 0.68, 0.51 to 0.89, and lower mean number of embryo transfers needed to result in a live birth, 1.55 v 1.82, p less than 0.001. The incidence of moderate preterm birth, 32 to less than 37 weeks, in singletons was higher in the blastocyst group, 1.87, 1.05 to 3.34. Conclusion: blastocyst stage embryo transfers resulted in a similar cumulative live birth rate to cleavage stage embryo transfers in women with at least 4 embryos available during IVF treatment. Next, we will be discussing articles from Lancet. Temporary mechanical circulatory support in infarct-related cardiogenic shock, an individual patient data meta-analysis of randomized trials with 6-month follow-up. Background: percutaneous active mechanical circulatory support, MCS, devices are being increasingly used in the treatment of acute myocardial infarction-related cardiogenic shock, AMICS, despite conflicting evidence regarding their effect on mortality. We aimed to ascertain the effect of early routine active percutaneous MCs versus control treatment on 6-month, all-cause mortality in patients with AMICS. Findings: 9 reports of randomized controlled trials, N equals 1114 patients, were evaluated in detail. Overall, 4 randomized controlled trials, N equals 611 patients, compared VA ECMO with a control treatment, and 5 randomized controlled trials, N equals 503 patients, compared left ventricular unloading devices with a control treatment. 2 randomized controlled trials also included patients who did not have AMICS, who were excluded, 55 patients, 44 who were treated with VA ECMO, and 11 who were treated with a left ventricular unloading device. The median patient age was 65 years, IQR 5773, 845. 79 middle.9% of 1,058 patients with data were male, and 213, 20 middle.1%, were female. No significant benefit of early unselected MC's use on 6-month mortality was noted. HR0 middle.87, 95% CI0 middle.74 to 1 middle.03, P equals 0 middle.10. No significant differences were observed for left ventricular unloading devices versus control, 0 middle.80, 0 middle.62 to 1 middle.02, P equals 0 middle.075, and loading devices also had no effect on mortality, 0 middle.93, 0 middle.75 to 1 middle.17, P equals 0 middle.55. Patients with SAINT elevation cardiogenic shock without risk of hypoxic brain injury had a reduction in mortality with MC's use, 0 middle.77, 0 middle.61 to 0 middle.97, P equals 0 middle.024. Major bleeding, odds ratio 2 middle.64, 95%, CI 1 middle.91 to 3 middle.65, and vascular complications, 4 middle.43, 2 middle.37 to 8 middle.26, were more frequent with MC's use than with control. Interpretation: the use of active MC's devices in patients with AMICS did not reduce 6-month mortality, regardless of the device used, and increased major bleeding and vascular complications. However, patients with scent elevation cardiogenic shock, without risk of hypoxic brain injury, had a reduction in mortality after MC's use. Therefore, the use of MCs should be restricted to certain patients only. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Resolution of acinar dedifferentiation regulates tissue remodeling in pancreatic injury and cancer initiation. Background and aims. Acinar to ductile metaplasia (ADM) is crucial in the development of pancreatic ductile adenocarcinoma. However, our understanding of the induction and resolution of ADM remains limited. We conducted comparative transcriptome analyses to identify conserved mechanisms of ADM in mouse and human. Results. We demonstrated that SOX4 is reactivated in ADM and pancreatic intraepithelial neoplasias. Contrary to findings in other tissues, SOX4 actually counteracts cellular dedifferentiation and helps maintain tissue homeostasis. Moreover, our investigations unveiled the indispensable role of SOX4 in the specification of mucin-producing cells and tuft-like cells from acinar cells. We identified SOX4-dependent non-cell autonomous mechanisms regulating the stromal reaction during disease progression. Notably, SOX4-inferred targets are activated upon KRA's inactivation and tumor regression. Conclusions. Our results indicate that our transcriptome analysis can be used to investigate conserved mechanisms of tissue injury. We demonstrate that SOX4 restrains acinar dedifferentiation and is necessary for the specification of acinar-derived metaplastic cells in pancreatic injury and cancer initiation, and is activated upon cross-ablation and tumor regression in mice. By uncovering novel potential strategies to promote tissue homeostasis, our findings offer new avenues for preventing the development of pancreatic ductile adenocarcinoma. Here are the articles from Clinical Gastroenterology. Symptom outcomes of celiac disease in those on a gluten-free diet. Background. Celiac disease is common, however, little is known about long-term symptom outcomes. Conclusions. In individuals with definitive celiac disease, with systematic long-term follow-up in a celiac clinic, roughly half remained symptomatic, despite a gluten-free diet. Many suffer from the same symptoms that prompted the diagnosis of celiac disease. Small bowel healing and abnormal serology and follow-up were not predictive of remaining symptomatic. These findings stress the importance of long-term care in celiac disease. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Changes in the appropriateness of U.S. outpatient antibiotic prescribing after the COVID-19 outbreak. Background. No national study has evaluated changes in the appropriateness of U.S. outpatient antibiotic prescribing across all conditions and age groups after the coronavirus disease, 2019, COVID-19, outbreak in March 2020. Conclusions. Despite an initial decline, the proportion of enrollees exposed to inappropriate antibiotics returned to baseline levels by December 2021. Findings underscore the continued importance of outpatient antibiotic stewardship initiatives. The next article. The value of outpatient parenteral antimicrobial therapy. Better care in 27 minutes. Outpatient parenteral antimicrobial therapy, OPAT, services save time for non-OPAT providers, decrease readmissions, 1. Limit in hospital days, 2. And save money, 1, 3, 4. Unfortunately, existing OPAT data include only limited information about the extensive uncompensated effort required to achieve those improvements in care. OPAT. Service leaders are therefore left to determine for themselves how best to structure their individual OPAT services and negotiate with local administrative leadership for remuneration and recognition for their important services. In this issue of Clinical Infectious Diseases, Schrantz et al., 5, seek to quantify uncompensated time that infectious diseases, ID, providers and staff spend delivering OPAT care to provide a benchmark for discussions regarding remuneration. The authors present a retrospective study of the University of North Carolina OPAT program between July 2020 to December 2022. The main measure of interest was OPAT time, which represented the uncompensated time spent providing management and coordination for OPAT patients, e.g., laboratory monitoring, onboarding calls, and patient concerns, and did not include clinic visits, scheduler time, or time spent reviewing patients before discharge. The measurement of OPAT time required that OPAT staff document their estimated time spent in the electronic medical record when completing OPAT-related work. Next, we will be discussing articles in the field of rheumatology. Here are the articles from Arthritis and Rheumatology. Returning incidental research findings from FDG, PET/CT, to participants. Objective. There is limited data on researchers' attitudes and beliefs on returning and managing incidental research findings from whole-body 18, F-fluorodeoxyglucose positron emission tomography/CT, FDG, PET/CT, imaging. Conclusion. While it is recommended that researchers report and manage incidental research findings, our data show differing views and uncertainties on what and how to return, and the extent of follow-up needed to manage incidental findings from whole-body FDG, PET/CT. This highlights the need for more specific and standardized guidance. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Induction of DEP1 by HIF mediates, multiple hallmarks of ischemic cardiomyopathy. Background. HIF, hypoxia-inducible factor, regulates many aspects of cardiac function. We and others previously showed that chronic HIF activation in the heart, in mouse models, phenocopies multiple features of ischemic HOF. Cardiomyopathy in humans, including mitochondrial loss, lipid accumulation, and systolic cardiac dysfunction. In some settings, HIF also causes the loss of paroxysms. How, mechanistically, HIF promotes cardiac dysfunction is an open question. Conclusions. Our findings identified DEP1 as a key component in the cardiac remodeling that occurs with chronic ischemia. Here are the articles from journals of the American College of Cardiology. Triglyceride levels, alirocumab treatment, and cardiovascular outcomes after an acute coronary syndrome. Background. It is unknown whether clinical benefit of proprotein, convertus subtilisin/casein type 9 inhibitors, is associated with baseline or on-treatment triglyceride concentrations. Conclusions. Among patients with recent ACS on optimized statin therapy, baseline triglycerides was associated with cardiovascular risk. However, the reduction in triglycerides with alirocumab did not contribute to its clinical benefit. From JAMA Cardiology. Postpartum ambulatory blood pressure patterns following new onset hypertensive disorders of pregnancy. Question. How frequent is persistent and severe hypertension after hospital discharge following new onset of a hypertensive disorder of pregnancy? Findings in this cohort study of 2,705 postpartum individuals, a hypertensive disorder of pregnancy enrolled in a remote blood pressure monitoring program, 81.8% had ongoing hypertension after hospital discharge. Compared with individuals with blood pressure normalization, these individuals had increased odds of postpartum emergency department visits and hospital readmissions, meaning these data support the critical role of blood pressure monitoring programs in postpartum individuals with hypertensive disorders of pregnancy. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. An open-label Phase 2 study of eniboparatide, a novel PTH receptor 1 agonist, in hypoparathyroidism. Context. Hypoparathyroidism is a rare disorder characterized by a deficiency in PTH, resulting in hypocalcemia, hyperphosphatemia, and hypercalciuria. Eniboparatide is an investigational peptide agonist of the PTH1 receptor for the treatment of chronic hypoparathyroidism, HP. Objective: to evaluate the efficacy, safety, and tolerability of eniboparatide in HP patients. Conclusion: eniboparatide allowed independence from conventional therapy and maintenance of serum calcium within a target range, while normalizing UCA excretion and producing a balanced resumption of bone turnover. Here are the articles from Diabetes Care Association between accelerometer measured irregular sleep duration and type 2 diabetes risk, a prospective cohort study in the UK Biobank. Objective: to evaluate the association between irregular sleep duration and incident diabetes in a UK population over 7 years of follow-up. Conclusions: irregular sleep duration was associated with higher diabetes risk, particularly in individuals with a lower diabetes PRS and longer sleep duration. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Pathologic substrates of structural brain network resilience and topology in Parkinson disease decedents. Background and objectives. In Parkinson disease, PD, alpha-synuclein spreading through connected brain regions leads to neuronal loss and brain network disruptions. With diffusion-weighted imaging, DWI, it is possible to capture conventional measures of brain network organization and more advanced measures of brain network resilience. We aimed to investigate which neuropathologic processes contribute to regional network topologic changes and brain network resilience in PD. Discussion. Although our cohort might suffer from selection bias, our results highlight that regional network disturbances are more complex to interpret than previously believed. Regional neuropathologic processes did not drive regional topologic changes, but a global increase in alpha-synuclein pathology had a widespread effect on brain network reorganization in PD. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Effect of corticosteroids on long-term humoral and memory T-cell responses in follow-up visit of hospitalized patients with COVID-19. Background. Corticosteroids have beneficial effects in improving outcomes in hospitalized patients with severe COVID-19 by suppressing excessive immune responses. However, the effect of corticosteroids on the humoral and T-cell responses of survivors of COVID-19 1 year after infection remains uncertain, as it relates to the extent of immediate, antigen-specific defense provided by protective memory. Research question. What is the effect of corticosteroids on long-term humoral and T-cell immune responses? Interpretation. Based on our findings, short-term and low-dose corticosteroid therapy during hospitalization does not appear to have a significant effect on long-term humoral kinetics or the magnitude and rate of memory T-cell responses to SARS-CoV-2 antigens. However, the potential harmful effects of long-term and high-dose corticosteroid use on memory immune responses require further investigation. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Potential diaphragm muscle weakness-related dyspnea persists 2 years after COVID-19 and could be improved by inspiratory muscle training, results of an observational and an interventional clinical trial. Rationale. Diaphragm muscle weakness might underlie persistent exertional dyspnea, despite normal lung and cardiac function in individuals who were previously hospitalized for acute coronavirus disease, COVID-19, illness. Objectives. The authors sought, first, to determine the persistence and pathophysiological nature of diaphragm muscle weakness and its association with exertional dyspnea 2 years after hospitalization for COVID-19, and second, to investigate the impact of inspiratory muscle training, IMT, on diaphragm and inspiratory muscle weakness and exertional dyspnea in individuals with long COVID. Conclusions. To the best of the author's knowledge, this study is the first to identify a potential treatment for persisting exertional dyspnea in long COVID and provide a possible pathophysiological explanation for the treatment benefit. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology: Lower Dosage, Acute Peritoneal Dialysis versus Acute Intermittent Hemodialysis in Acute Kidney Injury, a randomized controlled trial. Key points: the efficacy of acute peritoneal dialysis is still controversial. There was no significant difference in 28-day mortality between acute peritoneal dialysis and intermittent hemodialysis. Here are the articles from Kidney International Reports. Phase 1b/2a study assessing the safety and efficacy of felzartamab in antiphospholipase, a 2-receptor autoantibody-positive primary membranous nephropathy. Introduction. Primary membranous nephropathy, PMN, is most often caused by autoantibodies to phospholipase A2 receptor, PLA2R. M-PLACE, NCT 0414440, is an open-label, Phase 1b/2a study that assessed the safety and efficacy of the fully human anti-CD38 monoclonal antibody felzartamab in high-risk anti-PLA2R plus PMN. Conclusion. In this population with high-risk anti-PLA2R plus PMN, felzartamab was tolerated and resulted in rapid partial and complete immunologic responses and partial improvements in proteinuria and serum albumin in some patients.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.